have a very special guest here today who's got a really great story to tell. And right now, she is in the thick of the battle against breast cancer. And her story, the reason we want her here is her story is a lesson for us all. So I'd like to welcome Elisabeth Diaz. Elisabeth, welcome to our show. We're happy to have you. And I want to thank you for sharing something very personal. Right?
Absolutely. Yeah.
So maybe you can just tell us a little bit about yourself. You're 45, and you say your story kind of started when you felt a tenderness in your chest. What happened from there?
Right, there was, I had a little tenderness above my breast, and I went in for my annual mammogram, but I went a little sooner, went in, and that same day, after the mammogram, they suggested I get an ultrasound.
Okay.
Got the ultrasound, and then was called back for a biopsy.
And so what happened from there?
Well, from the biopsy, I found out that I had breast cancer. I mean, I was very grateful that I found out, you know, from the ultrasound.
You were
found out early.
Stage 1.
I was stage 1, exactly, and just very grateful that I found out so soon and early to make sure I could get the proper treatment.
Well, and I think the key here, to me, is that you felt a little bit of tenderness and you went and got it checked out. Because how often do we have like something we're like, oh, it's probably nothing, and we go about our day because we're too busy, we're too stressed, we're too whatever.
Every month, though, oftentimes we have tenderness, and you don't really
that's a
know.
Good point. I mean, what for you made you think, okay, this could be something out of the ordinary?
You know what? I really wasn't sure. I mean, when I went in, I thought that they would be biopsying the spot that I felt when it was actually a tumor inside my breast.
Wow, that's amazing.
Right.
So you ended up having a double mastectomy,
right,
correct?
double mastectomy.
And you've just completed the first round of chemo a couple of weeks ago.
Yes.
How are you doing emotionally, physically? I mean, how are you feeling right now? You use the word grateful a lot.
Right. Well, I'm doing very well. You know, I really, like any other patient, had no idea what to expect, and I have a great support group around me, which I'm thankful for as well. But I really never expected at my age to be in this fight. I see so many other women, and I had no idea what they go through. So I have a much more appreciation for breast cancer survivors.
Well, this is what really stood out for us as well, because Elisabeth, you did something very special for the imaging center that detected your cancer. You actually wrote a letter expressing your gratitude toward them. It was a fabulous letter, but we'd love for you to read a little part of it for everybody, if you wouldn't mind.
Absolutely. On May 19th, you diagnosed a breast ultrasound for me. Even though you have not met me, I just felt a need to write you a letter and tell you of my story and to thank you. I'm not sure how much you are thanked for what you do or find out what happens to the patients. I felt the need to tell you that you are appreciated.
I think it's such a special thing to do because you're right. I mean, in that line of work, I imagine the appreciation doesn't come enough. And so we wanted to have one of the radiologists from the center that detected Elisabeth's cancer here, Dr. Robert Posniak, as well as Sean Lyles, also from Sand Lake Imaging. So I want to welcome you gentlemen here. Thanks for being with us.
Thank you.
I mean, what's it like? Let's start with Elisabeth's letter. I mean, how often do you hear back from patients?
We don't hear often. But this was such an articulate letter that we passed it around and all of us got to read it, and it was really thrilling, and it just made us feel good because we do find a lot of breast cancer, but a lot of people don't communicate back with us.
Right.
So this was a wonderful experience for us.
Well, and we really want to highlight Elisabeth's case as well, because it's something a lot of women deal with is dense breast tissue. And you may not hear it a lot, but we want to start by breaking down Elisabeth's screenings. We'll do the mammogram first, and if we can, let's take a look at that. And from looking at the mammogram, can you guys kind of explain why you decided she needed an ultrasound in addition to this, what you do and don't see here?
Well, the difficulty with looking at a dense breast is that you can't see through it. The idea of the mammogram is to be able to see something different than the normal tissue. And what you see in Elisabeth's breast is the tissue all looks pretty much the same. And that's why it's critical when you have a palpable lesion to not stop just with the mammogram, that you have to pursue it with another study.
And dense breast tissue is a common thing. This is not some...
It's a common thing, and really what's starting to happen now is different states are starting to pass laws about how to deal with dense breast tissue.
Okay,
What do you do? I mean, how do you examine yourself if you have dense breast tissue?
Well, you examine yourself the same way, but you have to be very thorough. You have to do it monthly. You have to find any small change, and you have to act on that small change
Sure.
and go to your physician and follow up.
So that's an image of a dense breast, and earlier we saw Elisabeth's mammogram. We also have her ultrasound, which was the follow-up screen you guys did here, and now you can visibly see something. Can you explain to us what we're seeing on the screen?
Right. And the way we describe that is a hypoechoic lesion. In other words, the sound waves that go through the breast when we do this examination are picked up differently by the tumor than the normal breast tissue. And that particular pattern is a pattern that is very suspicious for malignancy.
Wow. Okay. So, Sean, we're glad you're here as well. And you have a great new convenience in screening we want to talk about. Tell us about mobile digital mammography units. It's like a mammogram mobile.
It is. It provides a very convenient alternative for those to get those recommended screenings where it minimizes downtime from work. So it's a mobile unit where there's state-of-the-art equipment that we can take to any site and provide those screenings for those who need them.
So it's just like the blood mobile. When you give your blood, you park it outside somewhere, whether it's a workplace or a drugstore or whatever. Let people know we're going to be there. And
Absolutely.
And just so you guys know, we had a few of our hosts here, and with our sister show, The Daily Buzz, they agreed to have a mammogram in the unit. So let's take a look at that.
Miss Jada? Hi, good morning.
Ready for me?
Yes, I am.
Okay.
My name is Carmen. I'll be doing your mammogram this morning. You're gonna step right in here, please. I'm gonna have you slip your shirt and your bra off. This gown open in the front. If you have any deodorant on, I'm gonna have you wipe it off with these alcohol wipes.
Okay.
When you're ready, come on out to this door and I'll be waiting for you, okay? We're gonna do 4 images. We're gonna do 2 on the left, 2 on the right.
Okay.
The entire exam takes about 10 minutes. Once we're done with the images, I'll make sure that they look good and then I will let you go. Ready? And you to feel some pressure. Okay, don't move. Very still. Take a very deep breath in and hold it for me.
For the process,
I
well,
did.
what was it like, Jada?
It was very easy, which I was really thankful for. But whenever you go in to have yourself examined, there's always that fear.
Right.
But they made it very comfortable.
Yeah.
You know, I really enjoyed the process, believe it or not, and that's really difficult for me to
So
say.
we do have the results of your mammogram, which is healthy, by the way. We're going to split
Okay.
screen it.
Yes.
And maybe you guys, just for people at home, because we don't look at these scans every day, if you guys can bring that up for us, I'm sure they're working on getting it. But tell us, you know, here, what you look for in a mammogram. Like we see Jada's on the right there. I mean, what's the difference here in what we're
Well,
seeing?
we're looking to see that all the tissues look homogeneous, that there's nothing that looks irregular, nothing looks like it's pulled back, because sometimes cancer causes scarring and it pulls the adjacent tissue. It
Yeah.
can also cause calcifications and rippling, and sometimes you actually see a mass as well.
Wow. So I want to thank you guys very much for joining us. Elisabeth, Dr. Pozniak, Sean, all of you guys for being here, sharing your story, sharing this information. It's really important to know. If you guys want more info on anything related to breast cancer, you can head to cancer.org.